The following is a presentation of Project Independence and WCWP. Project Independence is the Aging in Place initiative of the town of North Hempstead.
Welcome to Project Independence and You.
Good morning and welcome to Project Independence and You, Community Talk Radio on 88.1 FM and WCWP.org. I'm Rebecca Miller along with Otto Lohse. Otto Lohse is our co-host. How are you, Otto?
Good morning, Rebecca. Nice day.
Nice
Happy
day.
to be here.
Going to be a hot one, huh?
Well, you know.
It is the summer.
Yeah. We happen to be lucky, I think, compared to the rest of the country.
The rest of the world, actually.
You know, we're going to be in the 80s. I think Saturday is going to be in the 90s, but other than that, you know, we haven't busted the 100 mark, so I think we're okay.
Yeah, I think we're okay. I do. I agree with you. We're not as bad as other parts of the country and the world. But also, too, of course, is Kristina Liu, who is the radio show producer and also the director of Senior Citizen Affairs for the Department of Services for the Aging Project Independence. And I always like to say she's actually the producer of Project Independence, too. She just pulls everybody together, and she's really a very strong member of Project Independence. Of course, you're strong.
Thank you, Beck. My
Fabulous.
gosh, it's just so nice to all be together. I feel like it's been we haven't, all three of us haven't been, a unit in a while. So it's good.
I know. It's true. It's the radio show team.
Yes.
So as always, Kristina has pulled together a great show. Today's guests are not just guests who are going to speak, but they're frequent guests, and they're a true partner to Project Independence and You for years and years, probably since the inception of Project Independence, at least at its expansion point, and beyond. So we're so happy to have you both here. We have Lisa Stern, who is the Assistant Vice President of Senior and Adult Services at Family and Children's Association, and Jeanne Cacciatore, the Program Director of Senior Mental Health Training Program, Elder Abuse, Enhanced Multidisciplinary Team, which is EMDT, and Safe Observant Senior Program, SOS. So thank you both for coming today. And, we really look forward to hearing about the plethora of services that is provided by FCA. And, not just to our North Hempstead seniors, but to, seniors, I guess, countywide. And you can tell us a little bit more about that. So if you don't mind, for some of our listeners may not be familiar, FCA, so many of our partners have acronyms, and we really never truly know what, FCA may surprise some of the seniors listening that it's Family and Children's Association. But your senior services are, I think you're growing and expanding your senior services based on the needs of our older seniors, our super seniors, and so many people turning 65. So if you could give us a little bit of a background for our listeners, that would be great.
Yeah, we are expanding, and we do have our pulse on what we're seeing in the community, especially since COVID, where things really never stabilized well for the senior population in some areas. But it did highlight some of the challenges that seniors are going through. I would say Family and Children, we like to say we're a one-stop shop for seniors, because where we see a need, we develop a program. And right now we have more than 12 programs available to seniors throughout Nassau County, and our Alzheimer's program is also in Suffolk County. So we have, should I list them or?
Sure. I mean, you can list them, and then, I'm sure Otto is we'll list what they all are, and then we'll go into depths on a few of them that are really kind of like the newer ones.
I can highlight some of the areas where we've expanded
Sure.
our services. So we have our Smart Van, which came about because of COVID, when seniors were really, they weren't able to access technology as much as the rest of the population. A lot of the senior buildings don't have Wi-Fi, and they were really at a disadvantage and much more isolated. So the Smart Van brings technology to seniors. We can go to senior centers, senior housing programs, libraries. I think our next scheduled thing is August 18th. We'll be at the Mineola Library. And we kind of turned it into an intergenerational program. We partner with the Ozanam Scholars program at St. John's University. And we've trained the students how to teach technology to seniors, because they can't teach it the same way that they do to younger people. They have to take into consideration visual impairment, hearing impairment, maybe some memory issues. So we teach them how to go slowly, don't use jargon, have things written down so seniors can refer to that after they're taught. We also have tablets that are available for some seniors who are lower income and don't have any other technology. And we try to connect seniors to things like affordable connectivity program and Altice Advantage Internet, which can give them some access to broadband if you meet certain financial criteria. But it's really a fun thing too for seniors, because a lot of seniors have anxiety around computers. So we try to make it fun for them. And it's really been beautiful to see the intergenerational programming happening.
Does
So
that actually, I'm sorry, does it actually take place in a van, or do you take
yes,
the
the
stuff
van
out
has
of the van?
the van has 4 computer stations, and we have technology. So some of the buildings that don't have technology can use our Wi-Fi. So some of it can take place in the senior center, and we're using the van's Wi-Fi, but some seniors can come onto the van and use our computers as well. And they can bring their own technology also, so we can help them with that. Whatever their need is and whatever they want to learn, we can help them with. It's also good because when we have things like open enrollment for Medicare, we can bring the van, and our Medicare specialists can sit with seniors on the van and help them look at their plans and choose their Part D plan for prescription drugs. And we can use the van in other ways to connect with different types of entitlements for seniors.
How do you arrange for the van? If you do you reach out, or does somebody come to you?
We've been reaching out to our partners in the community, and whenever we see an opportunity to bring the van, we're a little bit limited financially. Like, we bring the van out like 3 or 4 times a month. And then right now, like the Ozanam scholars are taking a break. So now we have our staff and some seniors who are specialists in, really good at technology can come and work with the seniors as well.
And what about cell phones? Because I know most seniors have cell phones. Some of them don't use them. What we found during Sandy was that most seniors back then had cell phones and they didn't even turn them on. They didn't know how to turn them on. They weren't charged. They weren't functional during those times where, they really could have used it, the charging of the phone. So do you also provide cell phone instruction? Because there's so many different kinds.
Any technology that they need help with, they can bring, to where we are, and we can help them.
That's great.
Yeah.
How about
really
like
Alexa?
And good question.
Yeah.
Like Alexa type system.
Yeah, they can teach them how to use that technology, but that still has to be purchased. So, and it has to have Wi-Fi. So,
right.
Yeah.
Right.
But that's where we get a little bit, complicated with seniors who has Wi-Fi, who has access, who wants to pay for, some services. So we work with them.
But the tablets are free to give out?
Yeah, the tablets are free if you meet certain financial criteria and if you have no other technology available to you. But the other thing is we have a new program through AmeriCorps called the SCAP program. It's Senior Community Assistance Program. And I love this program because it targets seniors who are low income, and they can actually volunteer and receive a $4 an hour stipend for working with other seniors who need companionship or light housekeeping or errands run or respite care. So 5 to 40 hours a week they can work doing this. I say work, but I don't mean work because it's volunteering, but they get the stipend. And for some seniors, they can earn up to 200 or 250 a month. And that's really great because some seniors are struggling to pay for, at the end of the month, to pay for food or medication or co-pays. And it gives them a little bit more income, and it's tax-free, and it doesn't count towards their entitlements or their housing benefits. So it's a wonderful program through AmeriCorps that we've developed. And right now we have about 20 volunteers in that program that we're matching with seniors. We try to match seniors within their own buildings or their own communities.
Okay.
So there's not a lot of travel involved. It includes a little lunch stipend, and it's just a wonderful program.
Is this in person for the seniors? Because we
In
actually,
person.
during COVID, we established something, actually reestablished it. Kristina knows a lot more about it. It was friends helping friends, and it was virtual, whether on the phone or if, they all had Zoom, they could do that.
This is in person. And our coordinator, Jessica, is wonderful, and she really pays attention to matching people who have common interests, and people who are really in need. And it's just been great. And we have 20 hours of training, and it's background checked, fingerprinted. It's
excellent.
It's a federal program, AmeriCorps. So it's all.
Is this similar to the Friendly Visitors program that you have, or is that?
It's similar. It's similar to that, but the Friendly Visitor was 1 hour a week.
Okay.
Limited to 1 hour a week, and it was companionship, and it wasn't assisting with chore and other services like that. And there was no stipend. So, but we're still running both programs.
So I know in a lot of what I've been reading about FCA and COVID, it seems like we always say, some good did come out of COVID, and it was, a lot of these programs, how to connect, I'm sorry, I lost my train of thought. So Dan, you're going to have to move this out when we get to it. I'm so sorry. It was a good question too. So mental health support. During COVID, we talk a lot about this on Project Independence and You, how, the stigma of, any kind of mental health illness or requesting support is, there's a stigma. People are apprehensive about asking for help. They are apprehensive about even telling a family member thoughts that they might be having, that, they're down, they're depressed. But one of the things that seemed to us that came out of COVID is that there was there's a lot of mental health issues, not just for seniors, but certainly that's our focus. Kids in school having to, not seeing their friends, losing the opportunity to graduate with their peers, no prom, all those kinds of things. And just the forced isolation took a toll. And it seems like, all the papers are saying that the stigma isn't as strong as it used to be. The problem now seems like there's just not enough mental health services or suppliers or therapists out there, to kind of accommodate the needs. So I'm just curious, when did you guys start realizing that, hey, these mental health issues, people are kind of coming out now, with all these needs, and how did you guys kind of transfer or, in transition into this kind of new dynamic, which are a lot of people coming in and with, great needs for mental health support?
I'm so glad you brought that up. And I would say one of the things is that anyone who calls FCA now, we're realizing there are always mental health. It could come through our financial program for seniors that we have, our health insurance program, our linkage program, ISEP for case management. We're seeing just a heightened level of mental health challenges and substance use in the senior population. And I'm going to let Jeanne talk a little bit about the mental health. It's like, I'm so glad that you brought it up and what Jeanne's doing in the community.
Great.
Thank you for inviting me today. I'm really excited to be here and learn more about your radio program. So we have a grant through the Substance Abuse and Mental Health Services Administration to offer mental health first aid training to people who interact with seniors. So we're broadening it to the community at large. It could be for professionals, but you don't have to be a professional. And it teaches people to recognize signs and symptoms and responses to the, initial signs and symptoms of someone having a mental health challenge all the way to a crisis. But it's not learning how to diagnose or treat, it's learning, and with what you mentioned before, the big word stigma, is how to reduce stigma surrounding and maybe be that first layer of getting someone to the help that they need. But I do agree, Rebecca, that there is not enough providers. But we do have some new things here also that are expanding and beginning. So that mental health first aid training is free for anyone that interacts with individuals in Nassau County. They do not have to be a professional. It could even be you just have parents who live in Nassau County and you're trying to learn a little more. So we take the regular model of mental health first aid and we infuse some more information regarding seniors and psychotic symptoms that might be attributed to a medical issue, like a UTI. People don't always know that. So we try to explain the differences that will be affecting the senior population.
So you're more in the area of what I'll say, training the trainer, as opposed to like if I call up I have a mental health problem, you're not going to deal with me directly. That's
not that program, but we do have our linkage program. And I don't know if you want to, because I was just going to segue one more to the other program, the Safe Observant Senior. So that's for victims of elder abuse, but we do provide counseling, short-term counseling, and then we will really link them to something if they need long-term counseling. So we have some counselors on staff. We actually have somebody from another program within FCA that can take people who are really traumatized from their victimization, and she will work with the long-term. So it's tricky, Otto. I know that people have to call us and we can sometimes find the program and we have to meet the parameters of our funder. So, but we do have the CCBHC that's starting. Right. So like, we don't want people to feel that they can't call FCA for counseling, but we will do our best to match them to an appropriate program.
But we do also have our linkage program, which I want to highlight because linkage is for seniors in the community that are having trouble connecting with mental health or substance use issues. And we have 2 counselors, an RN, and also a peer in that program that works with seniors, and they do short-term counseling and connect them with long-term care resources.
Okay, we actually have to take a quick break. You're listening to Project Independence in You Community Talk Radio on 88.1 FM and WCWP.org. We will be right back with Lisa Stern and Jeanne Cacciatore from Family and Children's Association.
So I get this call from my grandma, and she's like,
"What's a podcast, and how much does it cost?"
So I tell her, podcasts are like radio shows, but you can download them on any device and listen to them anywhere at any time, and they're free. And then she says,
"I see, but where can you find good ones?"
And I'm like, go to wcwp.org/podcast and check out the lineup of original shows, or download any podcast app on your phone or tablet and search for LIU Studios. And she's all like,
"Oh, that sounds easy."
And then she asked me what an app is.
LIU Studios Podcasts, available on any podcast app. You know, those little button things on your phone screen. Just ask your grandkids.
And welcome back to Project Independence in You Community Talk Radio on 88.1 FM and WCWP.org. I'm Rebecca Miller along with Otto Lohse, Kristina Liu, and Dan Cox. And we have great guests today as usual who are friends and partners of Project Independence, Lisa Stern and Jeanne Cacciatore. I did give their titles earlier in the show, but it took about 15 minutes. So we figured we'd just use their names and they're here for you as well. So just before break, we were going over some of the offerings of FCA, and you had talked about elder abuse. I mean, it's horrible in any way, but it does also involve several different areas. It's not just physical. So, you know, if you recognize some of the things, I know you're going to expand on that a little bit, you know, FCA can help get you the services for those types of, you know, issues as well.
if I could just backtrack for 2 seconds.
Well, Otto, let's just let them, I wanted them to
Okay,
answer what
okay.
other forms of elder abuse
Yeah.
there are out there, so people can maybe hear it and recognize, hey, that might be something happening to me or my parent or a friend or a neighbor.
Okay, that's a great question, Rebecca, because the abuse, so our clientele can be referred by anyone, but most of our referrals come through the DA's office. But the money of the defendants in the cases, so we have a victim, which is someone 60 years or older in Nassau County, and the defendant or someone who's an alleged defendant is many times a family member and an adult child of those individuals who has some mental health issues of their own and some substance abuse issues and maybe co-occurring. So we have many clients like that, and we work, and the abuse that the family may be experiencing could include some violence. We don't get many that are very violent crimes, but it's harassment, it's kind of abuse. It could be a financial situation, and we do have a financial exploitation counselor that's specific for the financial exploitation. And I'll just segue to tell you that she goes out and provides scam education, but she'll work with somebody who's already been financially exploited. So she's preventing, and she's also helping somebody who may have lost their identity or someone is abusing their accounts, and she will help work with them. And that is all free. That whole SOS program is completely free. So we have a support group. We realize that many of the families are struggling. In addition to being abused, they're now feeling, shame and guilt. And meanwhile, it shouldn't be anything they shouldn't be feeling those feelings, but they do. So we bring them together to support them, that they're not alone. And we work on a lot of different issues about boundaries. How do you still love someone and put up the boundaries? I bring in a lot of guest speakers. I'm the facilitator of that support group. And we bring in many guest speakers, people who are in recovery and how they got to recovery. We bring in the mobile crisis team, someone to talk about that. Lots of different guests will come once a month to speak to our members there.
So important. And I like that you said too, that how do you love someone that might have abused you when you're a parent and it's the child? It's sacred that, and you just kind of learn. You just have to learn your boundaries and set boundaries. And I mean, in some instances more than that, but there is a light, there is support and help. So, and there should be no shame. It's really just, we always talk a lot about this is, it's important to take care of yourself in every way you can. And if these services are there, you're not alone. You're not the only person that has this kind of experience, because if you were, there wouldn't be so many services out there. So
I would also say that we also help victims file orders of protection. Right. We will go with them to the police department. We will go with them to court to support them, so they really do feel that sense of teamwork when they're in our program. They're not doing it alone.
If someone suspects that there's abuse, a family member, friend, whatever, is there a direction you could guide people? Like, what would you do if you suspected that somebody is being abused in whatever way? What's the way to handle something like that?
Well, they give us a call, and it gets tricky because we need the victim to be able to speak with us and want the help. There's all this confidentiality and consents to work with people, but we do the best we can. So if the victim themselves is calling, we'll go to the home and get involved a little bit there to see what other kind of services we might put in, because many times it's because the family is struggling and the tension is high, and they need other kinds of supports that FCA can also bring to the table. We also we work with the Safe Center, which is the the agency for domestic violence. They have a specific elder abuse channel, so to speak. Mm-hmm. And we work with Adult Protective Services, which leads to the other program that I wear a hat for, which is the Elder Abuse EMDT. So when there's a family or a victim or alleged victim that's struggling, we bring it before a team of people who work with seniors. So there's a geriatric doctor from Northwell. We have people on staff from the DA's office. We have the domestic violence liaison from Nassau County Police. We have not-for-profits that work with seniors to try to see how can we help, and attorneys from Nassau Suffolk Law Services. Adult Protective Services sits on that panel. And I will say, Otto, it can get tricky. It can get very tricky, because what I think, and I'd like to say this, what people don't understand in the community, and I never did before coming here, is a CPS has more teeth to be able to intervene in a situation because of the child can't make a decision for themselves.
We just, when you have the acronym, just kind of say it for people.
Yes, I'm sorry. I'm a big one for hating acronyms, so thank you.
I know, right?
Child Protective Services.
Right.
So Child Protective Services is a little different than Adult Protective Services, because Adult Protective Services can't force an adult who has the capacity to make decisions to do things. We offer many, many resources to people that we think that would be helpful, but they have to agree. So it can get tricky, but we do the best we can to assess. And what I love about this division is I'll walk over, we have a bill payers, you'll probably get to it. So the bill payers program helps people manage their checkbook, so to speak, and pay the bills on time. We're not giving out funding, but we have volunteers and people on staff that will help people keep their bills organized so their lights don't get shut off. But again, that person has to say, yes, I want to have
right.
And our bill payers sometimes are the ones that detect the abuse, because they see in the checkbook that something's not right, and they'll go back, and then it gets passed on to Jeannie and her team. So, and they'll get involved. So it's really a one-stop shop, like I said, and we're always coordinating our services.
Following through on that one-stop shop thinking, it sounds like, is there like if somebody has a problem, a lot of these programs, you mentioned you have 12 programs, a lot of people would fall into multiple programs. They're not going to call up the abuse department or the whatever department, the financial support department, whatever. How does it work in terms of somebody has a problem? They have problems. The person has living problems because of lots of different reasons: abuse, finances, mental health, any of these things. So now I know that FCA, I'm saying, has a lot of support that they can provide. How does that start? Like, would I call up and get a person who's like a planner for me that will plan or work with me on different departments?
I think if you are looking, it depends what you're looking for. If you're looking to help to pay your taxes, you can call here and get tax assistance. And during the conversation, you might ask for, you might recognize that there's other assistance needed. So then the person would say, oh, do you mind if I connect you with our ISEP program? Because they can provide you with some home care. Or if they're not paying their bills and they're struggling financially, they might say, would you like to meet with our senior financial counselor? So we always need the person's consent. So wherever it starts, we're all very trained to, to see what's going on and do, a pretty good assessment with the client.
Otto, if what you're asking is, can they call our reception area and say, I'm struggling, who can I speak to in the senior division to find out what your
something
offer
like
is?
that, yeah.
Okay, so that would be 485, correct? 3425?
It could be 516-485-3425, or it could be our 516-292-1300, which is more our ISEP program.
And of course, if you're a resident of the town of North Hempstead, you can always call the 311 call center. Actually, from anywhere, you can dial the phone number directly, which is 516-869-6311. And we can also help to connect you to FCA. And we can also assist in a lot of ways and work with FCA. So you can start out, if you're a North Hempstead resident, by calling 311. And, we'll definitely connect you to FCA when warranted. I have a couple of thoughts, and it's just something that's always in my mind. It's education is the most important thing. It's the only way, and it's so tricky. It's so hard to get the word out to seniors that aren't maybe as engaged with their community, with their activities, with their senior center. Maybe it's the much older seniors. And that kind of led into my next question. So it's kind of two-part. Well, it's not, the education part isn't a question, but I know what we do. We do everything we can to get our information out. If we can do a robocall, for whatever the scenario is. And it's not, you're still not reaching the people that would really benefit. So I'm curious on that part, how you all, get the word out. And the other thought that I have, and it's kind of new for all of us. I don't want to say we've mastered the younger seniors or even up to the 80s, but the super seniors, we've never had so many seniors living so long. And it's just going. I mean, we talk about this a lot on the show. When I was a kid, very rarely was anybody's grandparents around in their 90s. I mean, when they lived to their 80s, which today, I mean, Otto's like one of our dear friends. He's in his 80s. I don't even, it's like, it's the new 60 to me, but when we were kids, that was a long life just to get to the 80s. And today people are living so much longer. And of course, we know people think, oh, it's great, they're so healthy, but usually that's not the case because the body does get frailer, maybe cognitively you're well. So I'm curious what you've seen. I don't want to call it a trend, but it is kind of what's happening today. Our older population is growing. The numbers are only going to grow, which is that true silver tsunami. So what are the things that at FCA you're kind of recognizing about the much older, their needs? I mean, I'm sure their needs are so different from someone who's 68, or, that kind of a thing. So just wanted to hear a little bit about those higher seniors.
Yeah. So the first question is, how do we get the word out? And,
right.
I mean, we've been around a long time, so we have a lot of professional relationships, especially with the discharge planners at the hospitals. We get those referrals a lot, and those are the homebound seniors that have just been in the hospital and are being discharged home. So we get those calls a lot, and that's great to reach that isolated population. We're out and about, we're at the health fairs, we're at the farmers market. Because we have all the programs, we do a lot of outreach events. So Manza goes out and talks about scam awareness. That is a really big problem today. And also we do elder abuse training programs in the community, and our health insurance counseling program does a lot of trainings. Our HEAP program, our senior financial team has been going out a lot. So the word is out. And also the county, people can call the county's helpline and they will refer them to us. So, and then the other part of your question about the older seniors, our ISEP program can offer 20 hours of home care in the community. And it's a cost share program. So it's based on your monthly income and your monthly costs.
Okay.
But I think that has changed a lot because the Medicaid level has increased, and so has the ISEP level increased. So more and more people are eligible for those services. We also have 6 chore workers that can provide some kind of chore services in the home once every other week, and the Meals on Wheels program, which is a great program. A lot of people call for meals because that's the least threatening thing to call about. And when we put meals in, we do a complete assessment as if they're a case management case. And then we can offer them other services. Our senior financial program has been helping a lot with the entitlement programs, applying for Medicaid if you need more care and ISEP isn't enough care for you. So we can really help fill out those applications, which can be really costly if you go to an attorney.
Right.
One of the programs you have, we're trying to keep people out of nursing homes, but people do end up in nursing homes, and it's not always a pleasant experience. And you have a nursing home advocates program of some kind,
Yeah, we
which I
have the
found kind of interesting.
Ombud service programs. So we have volunteers and staff members that go into all the nursing homes, and there's posters in there for who to call if you're having a problem in the facility. Some people have problem with discharge. Some people have problem with the food. They don't like the food. Some people feel like their things are missing, or they're not sure that they're getting the care that they need. So we will meet with the facility and with the administration and work through whatever problems that they're having and advocate for them. And that's a New York State funded program. And that's a wonderful program. It was really hard during COVID. I'm glad that they're back in the facilities, because for a while they weren't allowed in the facilities, and it was heartbreaking. They did a lot of, talking to family members who were worried about their loved ones. So I'm glad that has expanded a little bit too. We have a little bit more staff now. Volunteering is a problem. We're having less volunteers, and that program really relied on volunteers. So, we're having trouble with volunteering in all our programs and recruitment. So if you want to volunteer, please call us up and we'll find something for you to do.
And even our labor, our HR department we're having trouble finding staff to replace people.
So
in
staff
positions.
and volunteers. We could talk a little bit more about that, but we actually have to take a quick break. You're listening to Project Independence in You Community Talk Radio on 88.1 FM and WCWP.org. We're speaking with Lohse Stern and Jeanne Cacciatore from Family Children's, and we will be right back.
WCWP is your home for great music and great conversation. You'll find all that and more on WCWP.org. Listen live on the web, check out the lineup, subscribe to podcasts, and stay up to date on the latest station events. Get in touch with us and let us know if you like what you're hearing. And find out how you can support or get involved at the only community public radio station serving Nassau's North Shore. Plus, sign up to get a free bumper sticker. It's all online at WCWP.org.
And welcome back to Project Independence in You Community Talk Radio on 88.1 FM and WCWP.org. I'm Rebecca Miller, along with Otto, Lohse, Kristina Lou, and Dan Cox. And time goes fast. We're in our last segment with Lohse Stern and Jeanne Cacciatore from FCA, Family and Children's Association, and beyond, because you have a significant number of senior services. And over the break, Jeanne, you were talking about some numbers. We always like data because it makes things real, when you have these research. And, we do talk about, the 10,000 people a day turning 65. And if, until the year, I don't know, when people born in 64 turn 65, I think that's kind of the last year of the baby boom generation. So what kind of statistics do you have that, enlighten our listeners to what we're looking at down the road?
Well, one of the statistics that's I've been explaining during my mental health first aid trainings is that by the year 2030, there will be more people, and I believe it's 60 and over than 18 and under. Yes. So we really will have a large population of seniors, and we have to address a lot of the things that we're talking about. I think there was an article in Newsday that talked about Long Island having the highest rate, and maybe Nassau County, I have to bring the article in, having the largest rate of Alzheimer's. And it's because a lot of people in Nassau County or on Long Island in general are living longer also. So we have a lot more people, say 85 and up, and they are more prone and at risk for some dementia, which is an umbrella term for memory loss, and also the disease of Alzheimer's, which I'm going to segue back to Lohse, if that's okay, about our Alzheimer's memory loss caregiver program.
And with people living longer, you're seeing more people that are seniors themselves, caregivers for seniors who are older, their parents. So you can have 65-year-olds taking care of their 85 and 90-year-old parents. So, and they're still working because they have to. So there's a lot of stress.
Right, a lot of stress.
Causing a lot of the anxiety and depression. Our Alzheimer's program is funded through Parker Jewish, and we target the underserved communities in Nassau County and Suffolk County. But we have support groups, we have education series, we have one-on-one assessments and connection to resources and services.
Can I just say what I love
I'm sorry,
about
when you
that?
say assessments, does that help assess that somebody has Alzheimer's, or is this
No, it's
assessing?
really caregiver focused. It's an
Okay,
assessment of what's going on for the caregiver and, you know, what they're experiencing and how we can help them as the caregiver.
And there are support groups, correct? And
Yeah, there are
what I
support
love
groups.
about it is if somebody is the caregiver of someone with memory loss, the two can travel to one location and go into two separate support groups. So the caregiver gets a little respite and support for being a caregiver while their loved one is actually in a support group, if they capable of being part of a,
Yeah.
you know, we always have to make sure that the group is right for them and they're right for the group.
yeah, and I believe personally that that's one of the roughest situations you can be in, is being a caregiver for somebody who has Alzheimer's. It's not like a 1 week deal. It goes on,
Yeah.
for a long time.
But
And
there's a lot of things that you can learn from the education programs, like how to respond to certain behaviors, because sometimes you don't realize that your response escalates the situation and makes it more difficult. So it's great when caregivers can share what they're going through, and then you can strategize on how the best way to address the situation is.
Otto, real quick, I want to go back to your question about how anyone can access our services. We have a wonderful website. So I just want to shout out for fcali.org. fcali.org. And there you click on programs and you'll see all, because we not only do we have the senior division, we have a lot of other divisions as well. So,
Yeah.
But if someone needs help navigating through that, they can call the numbers that are there and we will help them.
well, I realize like High Cap is part of your group, and
Yeah.
we've had Barry Klitzberg on a number of times.
Yeah.
And the information that he provides as an example is it's it's invaluable. It's very valuable stuff.
Yeah.
And
And I think what Jeannie said is also true, that we have a large agency. So we have residential programs, we have substance use programs, we have Thrive, which is for people in recovery. And we have our family support program, our youth programs and family programs. So it's great because sometimes our seniors have children they're worried about, and we can connect them there. If they're having substance abuse challenges, we can refer them to Thrive. And as I said, we have a peer in our linkage program that works very closely with our other resources at FCA.
Let me just explain. A peer is someone who is in recovery themselves from either a substance use issue or a mental health challenge or both. And they have lived experience, but they just don't volunteer. They are certified. They take classes, they have supervision, and they're paid for their role as using their lived experience to help someone else. So it's definitely expanding the peer movement. Some people might have heard it be referred to as a CERPA, a Certified Recovery Peer Advocate. So that movement is really, FCA is embracing it and bringing those people into our programs.
I think that's great, because I think the person who's been there knows a lot better than somebody who's just academically giving you some theories that they heard. There's a big difference, I think.
They're very effective sometimes.
Yeah.
It's such a great partnership too that Project Independence has with FCA, because since we're an aging in place program, our mission, if you will, is a little bit different. But a lot of the needs, like some of the needs of the residents, are maybe just transportation focused. They need to get to their doctor, they need to get to the supermarket, and of course we have this great federal grant that helps us provide taxis door to door during non-peak hours for senior residents to get to the supermarket. And they can, in fact, also send their caretaker in their place to the supermarket. So, or they can bring somebody with them, but it has to be, if it's the supermarket, it's got to be to the seniors, from the senior's address back to the senior's address. We got to make sure that food gets to that senior. So, we also have fitness programs and balance programs and a lot of that. So if you have, certainly North Hempstead residents and some of their needs, maybe we could help with, we do have balance programs during the fall. We also have Tai Chi classes and yoga classes. And you can, anybody who's in North Hempstead, they would have North Hempstead television, and we have fitness programs on there, with chair options, of course, and all kinds of things. And in that, we found during COVID that we were able to reach a certain number of seniors who are not into technology, and they still watch television. And they were like really appreciative of these fitness classes and called 311 and said, hey, we didn't even know anything about Project Independence because they're not technology savvy, or they're just isolated for what reason, they can't leave the house, or homebound. But, so there are still those seniors who, even though the SMART program is terrific, but there are, seniors that are still homebound and, cognitively great, but for whatever reason, they don't drive. They're just not, they're just not out there. So, and of course we have the social workers and nurses, and they can also do home visits. So there's just there's so many services out there for seniors. And like the Project Independence and You radio show is another way to get the message out. And that's why we also air it on North Hempstead television, and some of the social media that Kristina is much more, friendly with and knows all that kind of stuff. I'm not too shabby with it, but I don't really know as much as she does. So, that's the kind of, and I know you guys have been doing the education for a long time, but it's still so important to continually let people know, because we know people are getting older, and they may not have needed any of your programs or our services maybe until they hit 90, so it's just so important to keep the word out and coming to the health fairs. It was great to have you guys at the health fair at Fun Day Monday. It was really successful. We had a lot of people came. I'm still exhausted from it myself. But it's
all these programs count on people. They don't work without people. And you started earlier about the volunteer part of it. I believe that it would be good for those people who don't need the services at this point in time, maybe to commit a little time to volunteering to help these programs work. They don't happen by themselves. There's got to be people. There's people like Jeanne and Lisa who manage these programs, but you still need people. You need feet on the street, if you will. I think it's good for somebody who's older to do stuff like that. Really,
it's so true. We have waiting lists of people who need services because we can't always. We have to, do the best we can with the staffing that we have.
Yeah, but that's the premise of the SCAP program, is to get seniors more involved with volunteering and helping their neighbors. And I also love what Rebecca said that about the town of Hempstead and our partnership, because we refer all the time whenever the case manager.
North Hempstead. North Hempstead.
North Hempstead. Whenever the case managers have someone in the town of North Hempstead catchment area, we're so happy, because we know that we're going to be able to connect them with the transportation, and we're going to be able to connect them with the other things that you mentioned for socialization.
Right. Right. It's important for us to also know your services. It's important for you to know our services. And, that's really, Otto, kind of what you were talking about, I think a little bit earlier too, is how do you, in addition to learning about all the services, with Project Independence, we have the one call to town hall, the 311 call center, which is, a dynamic, innovative program that, you just call, there's a tracking number, whatever it is you need. You could have, what do we always say? You need a tree cut or a pothole, or, you're calling about a parent who might need some service. So you call, an SR is created, it goes to whatever department is handling it. And, and I like kind of what you were saying too before, because like maybe somebody's calling for a taxi. They need to go food shopping. One of our rules, and we have to abide by them a lot, is we don't do same day food shopping because we can't guarantee the taxi is going to get the person. There's a small window. So, but if somebody calls and said, well, I have no food, well, that's an issue. Then that goes from mobility management to Paula to figure out where that senior lives, what area of the town, and that social worker or nurse in that particular area will kind of look into a little bit more. Why don't you have food? I mean, it could be they could have food, they just don't have the food they want for the week. But, there's a lot of food insecurities and things like that. So, we're then able to, like you were saying earlier, we know that there are multiple services that could be needed. And, and then something could also come up that maybe the social worker would refer to FCA. So it's a great partnership that we have with you all.
The benefits of stuff like that, my story. My mother lived with us for 11 years. My wife and I were both working, and there was no Project Independence up here at that time. So anything you tried to do, you had to go find who to call, and you would go chop your way through a bunch of stuff. Whereas what you have here is you can make a phone call, tell your little story, and you can get guidance and go down a track to help fix the situation or make it better, and that's a tremendous advantage. 1-800-HELP,
We need 1-800-FCA.
Yeah.
Yeah.
I also think, just the partnerships that we have in this community, Nassau County is rich with services, and, we really collaborate with all of our community partners.
Yes.
You can't
And
do
that's
it alone.
great.
Yeah.
And we like, Otto, to make what we call a warm handoff, because we don't take our senior and just say, okay, call this number. I'll call with them. I will try to follow up and make sure that they did connect. And it's very difficult making those connections sometimes. The services are there and they're great, but getting through the front door of it could be a challenge. So
If you know where the door even is.
Yeah, you have to know where
Right.
the door is.
And I think that's also something we teach our staff, like that it's really hard for the senior to make that first phone call. And they don't like to ask for help. This generation is a very independent generation. So I think the staff, we're always training our staff to understand that, and our frontline staff who answer the phones, that this can be a very difficult call. So we want to be friendly and supportive and, really connect them with the resource they need. And we never say no. If we don't have the resource, we find out where to send them. We wouldn't leave someone without a plan.
Right. Yeah, we say that too. We we never hang up on anybody. Say, I'm sorry, we don't have that service. So, and there's a lot. There's, the one thing about North Hempstead is the reason that Project Independence, one of the many reasons that Project Independence is so successful is because we're so resource rich in this town, between Northwell and St. Francis and Winthrop and all the doctors that kind of practice nearby and the geriatric initiatives that, Northwell's looking at, and all the other hospitals and, all the other systems are kind of looking at. So, it's so important, Jeannie. I get to always talk about those statistics. That's like a huge awakening for people, a huge awareness that by 2030, there's going to be more people 60 and older than 18 and younger. The older population, for some reason, we don't have that voice. It's like, we talk about this too all the time. It's almost like when you get older, it's like a sickness, and unfortunately, we could go on, and I will definitely have you all back, but we're so grateful for all that you do, FCA. We're grateful for your partnership, and we look forward to many, many more years. And I know Kristina is going to have you on, and she's texting me already about programs that she wants you to do for the residents. So thank you so much for joining us here today.
Thanks for having us.
Thank you. Mental health first aid. Anyone can take the class.
Anyone
for
can
free.
take the class.
There you go. And you can call 311 and we will connect you to FCA. You're listening to Project Independence in You, Community Talk Radio on 88.1 FM and WCWP.org.